Hey guys, welcome to the Pulling Curls podcast. Today on episode 165, we are talking about what happens right before delivery. Like just rewind delivery an hour or so. What happens right then? Let's untangle it. Hi, I'm Hailey Erickson, the curly head behind the Pulling Curls podcast, Pregnancy and Parenting Untangled. There's no right answer for every family, but on this show, we hope to give you some ideas to make life simpler at your house. Life's tangled, just like my hair. Okay, I want to introduce today's guest. I have found her, I'm pretty sure on Instagram, where her handle is at your cervix, which is like my favorite. She is a labor and delivery nurse who loves creating beautiful births and memories of the birth. She is Hailey at your cervix on Instagram, and she has been coined by her fellow birth nurses as the crunchiest labor nurse on the unit, which I absolutely love. I want to introduce today's guest, Hailey. Do you feel prepared for your delivery? In just 3 short hours, you can be prepared for the confident, collaborative delivery you want. You'll know what to expect and how to talk with your healthcare team, and there are no boring lessons in this class. I'll use humor, stories from my 20 years in the delivery room to engage both of you. I love how Alyssa told me that she found herself laughing at things that used to sound scary. Most of all, you guys are going to be on the same page from bump to bassinet. Join the online prenatal class for couples today. You can save 15% with coupon code UNTANGLED. You can find the link in the show notes. Hey, Hailey, welcome to the Pulling Curls podcast.
Hello. How are you, Hillary?
I love having fellow labor nurses on here. It's just like giving the dirt behind the nurses station.
I know, exactly. It's like that inside little scoop.
The G-rated. Hailey and I were just saying all the swears that we end up using at the nurses station. So we'll try and keep it clean for everyone and their children today. Okay, so today we want to talk about like what happens before, like right before delivery, because I think a lot of that is a black hole in people's minds. I think people envision them with their baby like right after delivery, but it's just like blank as to what happens before then. Maybe they thought of like Rachel Green pushing, right?
Yeah.
Yeah. So when you get to 10 centimeters and we feel like you're ready to push, we'll start pushing. Well, usually I'll call a doctor when you're 10 centimeters and we start to push just to give them a heads up, right?
Yeah, I would say it definitely depends on your provider. We've got a couple that really love to just be called when half the head is out. As a joke, we always joke that half the head is out, but really it's just like a good crown and the patient's pushing well and then they want to be called.
Yeah.
We have a laborist in-house, so we have a provider that is there 24 hours a day. They trade off every 12 hours. So if for some reason their preference is a little too last minute, then the laborist will deliver the patient. But otherwise, like we'll usually let them know when the patient's complete. And we're either starting to push or they have an urge to push, so they can decide if they want to head in at that point or if they want us to just call them back and let them know. But depending on your provider, most providers want an update. Some are just like, call me when you need me to come put the gloves on.
Yeah. I will say it's just a heads up call. I never expect them unless it's like your 6th baby.
Yeah.
And then I'm like, I'm not pushing with this girl. We could laugh this baby out at this point.
Yes.
I'm not even telling jokes in that room. Like it's just silent. I have funeral music going on in there.
Yeah. I'm like, all right, don't breathe, don't fart, don't laugh. Like it's just going to come out. Otherwise don't sneeze.
Don't throw up. Definitely don't throw up.
Oh yeah.
Yeah. So I think a lot of people envision their OBGYN like with them while they're pushing, and that may happen. Well, some doctors, I've had doctors who love to be in there and push, bless their hearts, like 2 of them over like 30 doctors.
Yeah.
Mm-hmm. It's just not common. And midwives love to be in there and help you push. So if you have a midwife, you can expect them to likely be in there. Maybe not all the time, but they love to be in there, see the progress, see what we could do to speed things up for you. But most of the time, it's the nurse doing the job because honestly, we're the best at it. Like that's a lot of our training. And we tend to have a personality that's like a cheerleader, like, yes, you can do this. Let's do this.
Yes. Yeah. It's 100%. I always tell my patients that I want you to know, like, can you hear my voice getting like higher and louder? Like, because if that's happening and I'm getting higher and louder and I'm getting more excited with like you're pushing, like that means you're pushing so good. So like just keep doing whatever you're doing. Like the louder I get, the closer your baby is. I know that sounds so strange. I always tell my coworkers they always know when I'm pushing with a patient and my patient's doing well because they won't hear me at the start of pushing and then like right near the end they can hear me screaming from down the hall like, "Yes, you're doing so good. Like keep going. That's it." Like
I know.
the worst.
My kids, when they were little, they'd be like, I can't get the door to open. And I'd be like, keep pushing, more, harder. Like they would laugh. Just because we all have like these like zones we get into where we're like, yeah, you got it. Go, go, go.
Yes,
It's
yes,
a lot of cheerleading because
yes.
it's small gains. Like for most people, they'd be like, that baby has not come very far. But for a labor nurse, you're like, look at that. That's amazing.
Oh, yes. Like I have like the process of that final leg of birth. I mean, birth is just amazing in general to see the whole entire process from start to finish and be a part of it in any aspect is amazing. But like to see that last little bit where that patient is, pushing and they're pushing effectively, like seeing a baby born is like one of the most beautiful things in the world. I always tell my patients that like pushing is usually a marathon, not a sprint, especially if it's your first baby. So a lot of times it is like that, 3 steps forward, 2 steps back, 3 steps forward, 2 steps back, because you're trying to work that baby down. Like each centimeter of movement is like miles in a marathon. So, like, even if it feels like it's so long and it's taking forever, like every little bit you push, if you're pushing effectively, you are moving that baby with every push. It's just getting them all the way under that pubic bone. And once you hit that point, baby ain't going anywhere. Baby is coming out. There's no more backing up. That baby is coming.
Yes. And as a labor nurse, one of our big things that we learn in training is when to call the doctor, when that point is. Because it's pretty much once that baby slips under the pubic bone and they don't back up anymore. There's no backing up.
Yes. It's completely an exit. Not, I mean, well, in that sense, it's a complete exit, not an entrance.
Oh, it's multi-use, that area.
Yes.
All right. So then we call your doctor and we're like, and part of our job is to know how far away your doctor is. Part of our job is to like think about what the traffic is that day. Part of our job is to know, oh, it's Tuesday. He's in surgery. He's just at the hospital. Part of our job is to know he's in surgery and now we're totally screwed because he's scrubbed in. So, your labor nurse has so many things that we're thinking about at that point. And our job is to think about all those things. So all our patient has to do is to just push and us to time it right.
Yes.
Yeah. So after we call the doctor, then at least at my hospital, we would like clean you off with just some lightly soapy water just to get the area clean. In case you were to tear, there wouldn't be a lot of bacteria or whatever down there. I'm honestly not even sure why we prep the area. Because as soon as I'm done, I'm like, well, that was useless. Do you do that at your hospital?
We had a doctor that used to work with us that did a like true vaginal prep with the betadine.
Yeah.
That's kind of old school. But to be honest with you, like, we'll kind of, wipe you off as things are going on. But like, when it kind of gets to that nitty gritty point, like, we kind of just let it all, go. Obviously, I will say if you are having a bowel movement, obviously we're kind of like casually, discreetly getting that out of the way every time so that that's not a factor. But otherwise, we're just kind of like, we don't do any like major prepping of the vagina or anything like that. It's just kind of like as it is.
Yeah. This doctor went betadine to is it Betasept? What's the other clear one? Which we were like, come on, this is mucous membrane. So now it's just a little bit of baby wash. I don't know, but even all that. So they may prep you, they may just wash you off a little bit down there. Who knows? And then, usually then we would get out the stirrups, we've got out the handles, the bed turns into like a whole thing. Now, of course, it's super controversial. Nobody wants to birth on their back on social media, but having the bed that way is super important because if we have to stitch up a tear or anything like that, we need those stirrups available. And people can birth however the heck they want, but I have to say that a lot of people really enjoy birthing on their back so that they can rest in between contractions. What do you think, Hailey?
I've had a couple, I would say more so natural mamas that feel like, hands and knees is definitely way more comfortable for them. I would say it's not something our doctors are comfortable with. I've been a part of a couple of hands and knees deliveries that have been totally fine. It is a little awkward to get the baby up to mom, but like it's totally doable, but that's not, I would say that's more of a midwife okay preference than a OB okay preference. And it's not so much that they're, not about letting you do what you want. It's just that they are just not comfortable with that. That's just not how they've been trained. So, they're kind of like resorting to what they know. They're like, oh, this works.
Yeah.
Usually patients I feel like that have epidurals, your nurses, I mean, historically, especially I feel like nurses that are really seasoned or like new nurses that have extreme passion for the job are very willing to be like, hey, like let's do a couple pushes like in this like semi like reclined like lithotomy, and then like let's get in hands and knees. Like, let's push on your side. Let's get the squat bar. Squat bar, I'm a huge fan. I've had like multiple RN deliveries or almost missed deliveries with squat bars. They're my favorite. Primips, multips, doesn't matter. Love the squat bar. So I feel like a lot of nurses will like kind of pull out those tricks, tug of war, handlebars. Let's do this. Like, let's do that. I think, if you're open to wanting to push in different positions or, maybe one position's not as effective as another and another one is more effective, usually your labor nurses are going to be pretty open to doing that for you, during the pushing process. And then usually, if you're delivering with your OB, and your OB is not, either expressed that they're not comfortable with a different position besides lithotomy, or you're delivering with a doctor who by chance is not your doctor, because sometimes that does happen depending on who's on call if you come in active labor on your own. If that's not their comfort level, then we can push however we want. I always joke with patients, can push however we want because your doctor's in bed right now.
Or in the office.
Or in the office, or they are, down the hall in their call room waiting for me to call them, or they're in surgery downstairs. Like they're focused on something else right now. So we can push however is comfortable. And then when that baby is right there and ready to come, no matter what position we push in, that baby's going to come.
Yeah.
So at that point, then if the doctor wants more of like a lithotomy position, I would say usually we kind of move into that position. Obviously, if the patient's completely adamant that they don't want to do that, then you know what? Nobody can make you do anything you don't want to do.
Right. I will say that at those last few pushes, a lot of their skill is preserving your vagina for you.
Oh, yes.
So that is
Absolutely.
where they are best trained in. There is a very fine skill of pushing, like how they push and how they manipulate the walls of your birth canal so that they don't tear as much. And some doctors are great at it and some aren't.
Yes.
And
Yes.
and sometimes it doesn't matter because of your tissue type or how big your baby's head is or different kinds of things, but they're really trained in trying to preserve that while you're in stirrups most often, because it is really hard. Because I've done deliveries where the midwife is on the floor and they probably can't
Yeah.
do the pressure
They
and
can't
that kind
see,
of
they
things.
can't get a good handle. Yeah.
Yeah. So
Exactly.
So I think OBs tend to fall into the camp of this is how I'm going to do best. This is how I'm going to do my best work. Like if you brought your tile guy and you're like, I want you to do it on the ceiling, but I'm used to you doing it. He's a floor guy. He's probably going to be like, I mean, I can do that, but I'm not sure that things are going to look as good as they normally do when I do it on the floor. Right.
Absolutely. Absolutely.
The tile. I always come back to the tile guy. I have way too much tile in my house, but I just think that's something important for you to think of. But if you really don't want to move, then push on hands and knees. And I think your provider's not going to like have a fight about it most of the time. They're probably going to fight your nurse. They're not going to fight the patient.
Yeah.
Although I did see that one creator I follow on TikTok was in hands and knees, had a shoulder dystocia, and then had to get on the bed, So yeah.
Yeah.
Hard.
Yeah. Oh, yeah. Which is wild because hands and knees sometimes resolves a shoulder dystocia. So
yeah,
that baby must have definitely just been in there funky. And sometimes that happens too with like position wise of your baby. So sometimes no matter how you're pushing or, what position you're pushing in, sometimes baby's just coming out at like an odd angle or their hands trying to come out at the same time as their head, stuff like that. And sometimes no matter what sort of care we're doing down there, pressure, warm cloth, stuff like that. Like sometimes it's still just the natural process of birth, unfortunately.
Yeah, unfortunately, my vagina echoes that for you, Hailey. Okay, so your doctor comes in the room. When they come, we usually have like a setup of instruments. So that is not somewhere that your partner should be touching.
Yes.
Because we try and keep those as clean as possible. A lot of those might end up inside of you or be used in a sterile-ish way. It's hard to say that it's sterile because your vagina obviously isn't sterile, but we try and keep things as clean as possible because there is always a chance of getting an infection where you've torn, and we do not want that. No, thank you.
Yeah, no. We usually our tables they're covered in nice blue drapes. They're hidden in the closet, which is fantastic because this hospital that I work at now has a delivery table hidden in every closet in every room. Whereas my last hospital, you had to run down the hall to this one closet and pull the table out, and you had to race down the hallway with it. It was
Yep.
kind of a cluster. This one, it's nice, discreet. It's like, oh, you're 9. Oh, you're complete. Let's bring your table out. And we bring your nice delivery table out. It kind of hides in the back part of the room until we're ready. And Doc comes in and we'll pull that blue drape off, and all those instruments are kind of going to be out, kind of visible, and all the tools they're going to need for delivery and deliver your placenta, any kind of repair, all that stuff's going to be all laid out and ready. We got magic drawers in that table for any kind of extra stuff we need, all the things. It's like
Yeah.
magic.
Yeah. And so they'll bring that in the room, and it's super important for us to like kind of have access to that. It gives us a lot of emergency sewing materials, all sorts of fun things, hidden catheters. There's just so much in that table. And then the baby's head comes out, and usually you're like, yay, the head's out. And then come the shoulders, which is usually the largest part of the baby. And so that's important. All of that time is really important to listen to your provider. You know, they may say small pushes at certain points, and it's just with how the baby's head is coming through your vagina. We're trying to preserve that as much as possible. So listen to your provider at that point. Yeah. Do you have any other tips on that part?
I would definitely say trying to listen as best you can. I know that kind of sounds like a school child being scolded, but in the sense of like they're really trying to talk you through the best way so that like a lot of times I'll notice patients will start to really crown really well and they won't have a contraction, but the pressure is just so intense and like that burning is intense because that's that point where you hit that ring of fire. And whether or not you have an epidural, if you have an epidural, that like burning sensation, that stretching sensation, that doesn't get covered with the epidural. That pressure doesn't get covered with the epidural. So whether you're natural or not, you're still kind of getting that. So I've noticed a lot of patients, even without contractions, will get that very strong surge of pain and pressure and burning and want to push right through it, which is great in the sense that we want those powerful pushes. We want controlled, powerful pushes. If you're not having that contraction, as hard as it is, it's much better to let all those tissues stretch, let that baby's head kind of stretch and naturally kind of accommodate and kind of sit there for just a second. And then when your provider's like, okay, you're starting to get one, or that pressure gets even more intense, kind of then starting to slowly try to kind of just slightly bear down a little bit to just try to preserve those tissues as best you can. And it's so hard. I will 100% admit, been doing this for 4 years. I do not have a child. So I cannot say, oh my goodness, like it's just listen to your doctor. Like it's so easy. Like I have no 100% idea on how hard it is to do that. But I can only imagine in that moment, whether you're medicated or not, how it just feels like, oh my God, I want to push. I want it over.
Yes.
But it's like so important to that process of just letting those tissues naturally stretch and just taking those couple extra breaths, whether they're like, the pant, blow breathing, whether you find peace in like those big, longer breaths, kind of blowing it away, stuff like that. Or, if you want to just continually say a swear word over and over and over again for a couple seconds, whatever works best for you, just to kind of give your body a couple more seconds to let those tissues like really stretch and expand, because your vagina and everything is meant to fully expand, and kind of and accommodate baby's head and shoulders. So, that's extremely important. If you can kind of zero in on your provider and your care team, your labor nurses and stuff, to kind of listen to what they're saying when it comes to breathing and pushing.
Yeah.
But obviously at the end of the day, the body's the body. The fetal ejection reflex is a thing. So sometimes that just kind of takes over.
Yeah. I know there's a lot of people on social media saying, oh, the lithotomy is where the worst tears happen, which I disagree with. But I will say the worst tears I've seen are at home on unanticipated deliveries where somebody's just in the shower and has their baby just because.
Very unexpectedly. Yeah.
Yes. Because they just like push that baby out and they don't get any of that stretching time, because naturally our body just wants to like explode that baby out, which is what it ends up looking like. So listening to your provider at the end is super important, no matter what position you're in. and they really are there to help guide the baby. And something that I've heard is a lot of people feel better by saying, oh, it burns, because at that point we can kind of distract you with like, that's so normal. Your baby is so close, you know? So verbalize what you're feeling and then we can talk about it. And your baby really is going to be born right soon as you get towards that end. But it is, yeah, you feel like you're just like, get it out.
Yes. And sometimes too, I've had patients that actually kind of find a little bit either encouragement and kind of a mirror at that point when baby's
Mhm.
starting to crown a little bit. It kind of takes like a minute of distraction of like, oh my God, oh my goodness, the baby's right there. Like that's what I'm feeling. Oh my goodness.
Or touching the baby's head. Yeah.
Yes,
Yeah.
yes. Or reaching down and touching your baby's head, being encouraged that, oh, baby's got a lot of, like dark hair. Or we had a baby probably about almost 2 years ago now that was born with like white hair, like white hair. And as baby was crowning, we were like, oh my goodness, your baby's got such beautiful, bright, white blonde hair. And like, sometimes that's just so wonderful to hear, that can sometimes just distract you and just like give you that rush of, wonderful feelings and emotions, to kind of help you just kind of distract for a second, even if you're kind of feeling overwhelmed or nervous or just get it out. Like sometimes I've had patients reach down, feel that head in the moment, and they're like, oh my God, oh my God. And they're kind of like able to like, kind of recenter, kind of get some breaths, be like, oh my God, I can't believe it. I can't believe it. And then, kind of gets them a little longer to that next contraction to kind of help all those tissues stretch, kind of get ready for that next big push for the rest of the head and, the shoulders too. So
I think a lot of people like kind of like act real medical at that point, but there are so many emotions in play of, oh my gosh, my entire life is changing
yeah,
with this next push. Like this is a, it's like a wedding and a medical procedure all in one.
and I always feel like, you're still always a mother even when you're still pregnant, but like that's the defining moment that like that baby is here. I have so many mothers that after they've delivered, that'll just look at the baby or that, be watching when we're doing, like vitals or if we're doing their weight or something. And they'll just be like, I just can't believe they're here. Or, they'll see their significant other hold the baby for the first time or, a family member hold the baby for the first time and just be like, I just can't believe it. I just can't believe they're here. They're finally here. They're real. I'm looking at them. I'm not pregnant anymore. Like,
I know it
like
because
that
sometimes
turning
you're like,
point.
it's make believe, like I'm just super, super fat and have a lot of gas. And that's what's going on in here because I can't believe there's actually, and looking back at it, I can't believe that my kids actually were created inside my body. Like that really seems make believe to me now.
You're like, you're just here. You just showed up. Like,
Right. It makes
the
a lot
stork.
more sense that the stork could come and bring a baby, honestly. Okay, so after baby's born, we're going to do delayed cord clamping. Now, a lot of people get their panties in a bunch. That is the standard of care, 30 to 60 seconds of delayed cord clamping. If you want it to be longer, you can. But the sad news is a lot of babies' cords aren't long. Maybe not a lot, but a good number are not long enough to stretch to where you want the baby at, right?
Yeah, I'd say probably about like 60-40. I'd say like 60 are kind of shorter. They usually end up like kind of like right on your like upper mid belly.
Yes.
And then we get a couple that like I'd say like 40% of them that are like super long and juicy, and you could like put that baby up next to your head if you really wanted to. But a lot of times they'll have a smidgen of a shorter cord until that placenta kind of starts to let go. But, at that point, usually, even if it's been a couple of minutes of delayed cord clamping, at that point, we've cut the cord at that point. So the baby's already kind of up on your chest.
Yeah.
So your baby kind of ends up like on your lower belly or like your belly button area. So it's kind of a little awkward. Sometimes can be a little hard to get a real good look at that new fancy cheesy baby of yours. But
Yeah, worth the delayed cord clamping. But I know a lot of people are like, why don't they just delay cutting it forever? Well, I mean, lotus birth, but we are not going to go in there today. But a lot of times it's hard for mom to get a good look at baby, and it doesn't feel very stable with them on your upper abdomen for a lot of moms. So I think a lot of people like it when we cut the cord and baby can come up close to you where you can see him better.
yeah.
Yeah. So, I mean, that's pretty much it. I will say as a nurse, there is so much work that happens in this time that we've talked about. Like that's our big, like lots is getting done, right? You're like calling the doctor. Am I doing it right? Are all the supplies guys in here. Have I called the baby nurse? And then after delivery, you're like, how is their bleeding? How is the baby? How is the
How are the vitals? Well, let's weigh your baby. You want some pain medication? You need to eat something before we get up to the bathroom. Like
Yeah.
all these things. Yes, exactly.
A lot of people are like, is it just magical every time the baby's born? And I'm like, sometimes you are able to take a breath and just be, especially if I've been with that couple for a long time. This is amazing. It's just magical. It's better than Disneyland. It's amazing. But sometimes you're just like, oh my gosh, sometimes it's just so much work for the nurse.
Sometimes it is. It can be like, it's quite like your brain's on a million things. I had a patient just a couple nights ago that I was trying to disconnect some tubing, like one set of tubing from another set of tubing on her IV, and it was stuck. And she was asking me a question about something, and it was like kind of a semi-detailed response, and I wanted to like give her my full attention and give her the complete accurate information and response. And like I tried 2 times to start explaining it. And every time I just could not get this tubing disconnected. And I was like, I need to get this disconnected because I need to keep like moving on these fluids and things that I'm doing. And I literally said to her, I was like, I'm so sorry. I said, this is like bothering me so much. I can't get this disconnected. I said, I cannot focus to actually speak to you thoroughly. Like, let me just get this undone and like finish this, and then like we can have like a very thorough conversation. I will break everything down. Like there's no emergency. Like everything is good right now. Like I just literally cannot talk and do this at the same time. Like, and normally that's not well for me. Normally I can be doing something and give a relatively good like conversation and explanation, but I just could not. So like sometimes there really is no time for that like really good breath.
Yeah. So that's what happens at delivery. And I love how I just described it. It's like a wedding and a medical procedure all at the same time. Everything's
Yes.
changing. So, yeah, it is a magical, amazing time. And this can be just as amazing if you're in the OR. A lot of people are like, well, the operating room couldn't be just as magical. But the first time you see that baby, it's just a lot. Things are very real.
Absolutely. I would say too, depending on like what the reason is you're going back to the OR for, kind of dependent. I would say, I mean, regardless, the best sound in the world is the baby cry. But I feel like, depending on what reason you're being sectioned for, or, if like your hospital does clear drapes or drops the drape or anything like that, that cry is like that first thing you hear and know like, oh, my baby.
Yep.
It's like that first real thing. Like, and that's just like, we had a NICU nurse the other day that said to me, she's like, oh, I've never heard a better sound than when a baby cries. And that's so true. Like when a baby cries and you're like, oh yes, like we have a baby, this baby is crying, this baby is well, this baby is beautiful, it's born, it's its birthday. Like there's just nothing, and that mom that is just like, whether it's right after delivery or some point after delivery, that's like, oh my God, I did this. Like, this is my baby. Oh my goodness. Like the baby is here. Like there's nothing better in the world for a labor nurse or any kind of obstetric nurse, women's health nurse than to, have that moment with you. It's just wonderful.
Yeah. Even when we're not the baby nurse, I'll be like in the middle of something else, making bands or whatever. I'll be like, what is going on? Come on, come on, come on, come on. And then you hear it cry and you're like, oh, okay, good.
Oh, yeah. Yes. Oh, we have a baby. Perfect. Lovely. Okay, great. All right.
Yeah, moving on. All right. Thanks for coming on, Hailey. Where can people find you?
I have a Instagram page. It is Labor Nurse Hailey at your cervix. I think I've had a rough night. I've been up all night. So
yeah, at your cervix. That's why I was like, as soon as I saw her, I was like, we are clearly best friends, because I always wanted my manager to make pens that said at your cervix that, we could just drop in patients' rooms. And she was like, what if people found those outside the hospital? I was like, it would be amazing. I don't know what you're talking about.
Nifty. What kind of pen is this? Where did this come from?
Exactly.
I'm a big pen collector. So anytime I see like a homeless pen, I'm like, oh, you're coming home with me.
Oh,
Come
yeah.
here. Like, yeah.
Pens are like gold in the hospital, and a good pen. Oh yeah.
Cool.
That's
Beautiful.
like nurse porn when you're like, oh, look
It
how
is.
that writes. Ooh, that feels good.
Oh, yes, absolutely.
All right. Find Hailey at Nurse Hailey at your cervix. I'll put the link in the show notes. So just click into the show notes. You'll find her, and then follow her on Instagram. You're on TikTok too, right, Hailey?
I am. To be honest with you, I've only got one video on there right now. My life's been pretty crazy since like the very end of June. I've been kind of like really behind on life and on my Instagram page because I have a lot of things going on. Work's been busy. I actually got COVID for the very first time at the end of July.
Oh.
After I had come back from a 2-week vacation, I went to England. So I had been overseas. I got engaged. So my life has been insane. So my page is kind of a little bit weak at the moment, but I am on TikTok. But to be honest with you, I don't remember my name on TikTok either because I
I think
only
it's
have
the
one
same.
video.
I think it's the hint.
It's
But
very,
anyway, find her on
it's
Instagram
very
because she has
similar.
lots
Yeah.
of great content that will reassure you before your birth. She's not one of those scary creators. So check her out. Thanks for coming on, Hailey.
Absolutely.
We'll talk to you later.
All right. Bye, ladies.
Okay, I hope you guys enjoyed this episode. Hailey is so fun and positive, which I think is awesome. I get tired on social media of seeing all the people who just like to rant about either doctors or birth or all those different kinds of things. I think she brings a positive light to birth experience, so definitely follow her on Instagram. And there was one other thing I was thinking about while we were chatting. I recently reviewed the Rachel and Ross birth scene, and in that she goes, I can't. And I have to tell you that is so normal. It's normal to be like, I can't do this, because there's all those emotions, but your labor team is there to totally cheer you on. I can't tell you how many moms have told me that they can't, and they totally could. So it's normal to feel like you can't totally verbalize that. That's okay too, but know that it is so normal. Stay tuned, because next week we are talking to my friend Allie about playing with your baby. So that's a great one for you, my pregnant mamas out there. And then the week after that, we are talking about communicating with your healthcare team, which honestly I think is important. Pregnant or not, just learning to communicate with healthcare providers is such a gift as you move forward in your life. So stay tuned for those. Thanks so much for joining us on today's episode. The Pulling Curls podcast grows when you share us on social media or leave a review. If you do, please tag us so that we can share and send you a virtual hug, which frankly is my favorite kind of hugging. Until next time, we hope you have a tangle-free day.